I'm Dr. Carlos Perez. A very uncommon name in Miami. I start off really as a paramedic, EMT paramedic, very young, 18, 19 years old, dropping off patients with physicians and doctors, providers in the emergency room. I did the whole fire school, EMT paramedic schooling. I was waiting to get calls from the county, and a few physicians actually planted a seed, so to speak, and they said, hey, you speak the language. I like the way you present things. Maybe you should continue off in school. Ironically, one of the doctors that I disliked as a person, but respected very much as a physician, is the one that really emphasized it and pushed it that much more. And that's how I end up actually going back to school and becoming a physician. I think we have to kind of steer away a little bit from the word general medicine. General medicine is very important. We need to generalize, and we need to have an understanding of how it's like to diagnose people and understand them from head to toe. And when you're a generalist, you can do that. However, to understand what we do from a primary care perspective, family medicine is a 3-year residency, sometimes even 4, that you actually rotate through OBGYN surgery, psych, pediatrics, internal medicine, couple other things throughout the course of the 3 years, over and over and over again. You become very comfortable treating a lot of different elements and a lot of different diseases and diagnoses from that perspective. That's a great question, actually. I was not expecting it right away. As you
Really?
Yeah.
Huh.
You know, I'm at a point in my life right now. I want to make a difference. And I want to make a difference in more than one way. So far, I've seen a very vibrant, energetic group that really is trying to focus on quality care and focus in on making sure that the patient is good as a whole from head to toe. I want to make sure that I perfect that as possible, as much as we can, and understand and make the patients in our practices feel as comfortable as possible. Build a good provider-patient relationship is, I think, my long-term goal here. Come back. It takes months, years to get to know a patient. It's not something that you get to know overnight. Yes, we went to medical school. Yes, we're doctors and providers, but the reality is that takes a long time to get to know somebody. That's the reason why they call it a practice. Medicine is a practice. That relationship between a provider and the patient, when you actually have it, it's built correctly, it's a bond that can't be broken. They should know their history. They should come understanding that, at least for me and our staff here, we're going to accept the challenge if you Google something. We're going to accept the challenge if you ask your aunt something or your mom something or something like that. That just might open the door for us improving and coming up with a better diagnosis. But make sure you know your family history, your surgical history. That's how you get screened. That's how we prevent you. I trained in Louisiana at East Jefferson General Hospital. It's affiliated with Tulane, and it was before, during, and post-Katrina. We did everything from a family medicine perspective. We were in the hospital, in the clinics. We were from head to toe with our patient population. That creates a trust with the patient because you really are doing just about everything that you need for the patient, as it should be. From a primary care perspective, the misconception that the doctor's only there to either give you a referral or just treat you very generally over the top, bronchitis, sickness, this and that. That's not necessarily what we do. We make sure that you're good from head to toe, and that takes significant amount of time. That's easier, and always it's an easier sell, if you will, the doctor-patient relationship in Louisiana than it is in South Florida. Since I've been in South Florida, there is a big misconception and a lack of trust, if you will, with the primary care providers. And that actually focuses in on a number of different reasons why. The doctor, they're burnt out, they're overwhelmed. What happened here in the 80s with Medicare, 90s with Medicare, et cetera, et cetera, et cetera. So there is a lack of trust, and I understand it why. I want to bring back that trust with the primary care provider and the patient. I think it's very important for the patient, and the message should be clear, that we train to make sure that you're okay from head to toe. We're the ones that really know where you need to be. And if you need that consultant, most of the times you don't, But if you really need to go to that specialist, if you really need that procedure, if you really need that. So in my training, I had the advantage of having patients come and ask me, hey, somebody says I should do this procedure, surgery, et cetera, et cetera. How do you feel about it? And that's the relationship that you should have with your doctor. It starts day one, and it's about making the patient feel comfortable. You have to make the patient feel comfortable because you have to assess and create a plan for this patient 30, 45 minutes later in a relatively short period of time on what you're going to do from a preventive medicine standpoint. Well, I need to make them feel comfortable for me to gather all that information to assess and plan them moving forward. And I want them to have good rapport with me moving forward. So that comfort level can't be broken. At the end of many of our visits, especially with my male patients, I've had a lot of them tell me, I've never said that before to a physician, and that's very comforting. So it's all about making them feel comfortable.